Okay, we are going to do a cranial nerve exam, a more in-depth exam of the cranial nerves. So first we're going to start with cranial nerve 1. We're going to test the patient's sense of smell. So I'm going to ask you to close your eyes and your nostril and one of your nostrils. Let me know if you can smell this and identify the smell for me.
Okay.
So go ahead and close your eyes and close one nostril for me. I'm going to work with this.
Smells like cilantro.
Very good.
In my right nostril.
If you can close the other nostril for me. And smell this.
Smells like coffee.
Very good.
In my left nostril.
So cranial nerve 1 is intact. For the second cranial nerve, we're going to check the patient's vision in a few different ways. First, we're going to do a near acuity test. We have our near acuity sheet. So I'm going to hold this about 3 feet from you, so roughly here. I want you to read the lowest line on this sheet that you can out loud to me.
SYKDN.
Very good. So that was intact. Next, I'm going to check your visual field. So I want you to go ahead and close one eye and look straight forward for me.
Okay. Yeah, all right.
Yep, very good. And I'm going to ask you to let me know. I'm going to swing my finger through your visual field. Let me know when you can see the eye come in, and then let me know when you see the eye go out of focus. So can you see, or my finger, sorry.
Yeah.
Can you see my finger now?
Yeah. I can already see it.
All right, ready? I'm moving in so you can see it here. Okay. Good.
All right.
Let me know when you see it leave.
It's gone. Yep.
Very good. Close the other eye for me.
Okay.
Switch eye, same thing. I'm going to bring it in and let me know when you see it leave again. Okay? Can you see my finger here?
Yeah.
Can you see it here? How about here?
Okay. Yep.
Gone?
Yep.
Okay. So let me know when you can see it.
Okay. I can see it.
Good. Let me know when you see it leave.
It's gone.
Very good. So this seems to be symmetry in both eyes there as far as where the visual field is, the peripheral visual field. Next, we're going to check your reflexes, and then we're going to check your quadrants. So I'm just going to shine this light in your eyes real quick. Let me know if you can see the light, or you can see the light, or you should be able to see the light.
Yeah.
I'm going to shine. Just look straight forward, and I'm going to check for a reflex in your pupillaries. In your pupils.
Yeah.
So look.
Right.
Go ahead. Look straight forward for me.
Yeah.
Good. Good. So there was both the consensual reflex and the direct or pupillary reflex were both present. So that's good. Next, I'm going to just have you follow the tip of this pen for me. Keep your head straight forward. Follow the pen. Good. I'm going to bring it closer to your face. Let me know when you see double of this pen.
See double?
Good. So that was about within 2 inches of the patient's face. If it was greater than 5, it would indicate that the cranial nerve has been affected. Next, I'm just going to do a quick quadrant screen, so if you'll stand up for me. Go ahead and face me. I want you to close the same eye as me, so go ahead and close your left eye. And I'm going to place my finger here, and I want you to let me know if you can see my finger. All right? So here.
Yep, I can see it.
How about here?
I can see it.
How about here?
I can see it.
How about here?
Yep, I can see it.
Very good. We're going to check the other eye, so go ahead and switch eyes. Can you see my finger here?
Yep, I can see it.
How about here?
Yeah, I can see it.
How about here?
Yep.
How about here?
Yeah.
Very good. So all quadrants were visible to the patient, so that's good. So go ahead and take a seat for me.
Okay.
Good. All right, next we're going to check sensation and motor control of cranial nerve 7. So if you will go ahead and close your eyes, I'm going to give you a light touch just like this. And I want you to let me know if you can feel it and where on the face you can feel that. Okay?
Okay.
So go ahead and close your eyes for me. I'm going to give you a light touch here.
Yeah, I can feel that. I can feel that. I can feel that.
Okay, tell me where you can feel it as well.
Oh, yeah. I can feel it on the top of my left head.
Good.
I can feel it on my cheek, my right cheek.
Good.
On my right jaw,
Good.
my left jaw, my right forehead.
Very good. So you can open your eyes up. Okay, and then we're just going to check the motor component of that nerve, which is cranial nerve 5, by the way. Sorry, I think I misspoke earlier. So if you go ahead and clench your jaw for me, nice and tight, squeeze those jaw bones together. Good, and relax. Good. Can you move the jaw side to side? Like that. Good. So the motor component of that nerve is intact as well. Next, I'm going to ask if you're going to just follow me, make a few faces. Can you give me a nice big smile? Good. Maybe a frown. Good. Can you puff your cheeks out? Very good. So patients able to make facial expressions. Next, we would also check the sensory component of this nerve by placing something sweet on the anterior 2/3 of the patient's tongue. So I would have the patient close their eyes, open their mouth, stick their tongue out, and then place something sweet like a mint or a candy and ask them if they can identify the taste and if they can taste it. But we don't have any of that present right now, so we're going to skip through that. Next, I'm going to just assess hearing and the vestibular portion for cranial nerve 8. I'm going to give you a light ruffle in your ear. Let me know if you can hear it, and then tell me which ear you can hear it in. All right, so I'm going to ask you, and then I'm going to let you know if you can hear it, if you can't hear it, and which ear you can hear it in, okay? So go ahead and close your eyes for me.
I can hear my
Can you hear
right
that?
right ear.
Very good. Can you hear that?
No.
Very good. Can you hear that?
My left ear.
Very good. And can you hear that?
No.
Very good. So hearing is intact. For the vestibular portion of that nerve, of this nerve, I'm going to have you stick your thumb out right in front of you like this. Good. Stick your thumb out, good. And then I'm going to have you keep your eyes focused on the thumb, but move your head from left to right, if you can. Can you go faster? Good. I'm going to play this this metronome. I want you to see if you can match that to the metronome.
Sure.
Very good. Very good. Good. So the vestibular portion of that nerve is intact as well. Next, we would test. We're going to test cranial nerve 9, and we would assess the ability to taste kind of a salty flavor in the back portion of the tongue. So we would do the same procedure, have the patient open their mouth, place something salty in the back of the tongue, and then see if they can taste that. Yes. Yeah. I'm also going to assess kind of the motor portion of that nerve through assessing the uvula, the dangly thing in the back of the throat. If you will open your mouth nice and wide and say ah for me. Good. And now see, we're going to check the next couple nerves to see if you can go a couple pitches higher, like a ah. Very good. See if you can go low. Very good. So we saw the soft palate move there, and the uvula was moving as well. So that's all intact. Next, we're going to ask the patient to shrug their shoulders. Shrug your shoulders nice and high for me. Good. Relax. And then lastly, if you can stick your tongue out for me and move the tongue side to side. Very good. And relax. All right. So all cranial nerves were intact for this cranial nerve test.